who is sitting right here with us today. So thank you so much for making the time to be here with us. So you can answer some of the questions that we came up with and also share some things that we probably don't know that you have your thoughts in regards to the audit. I know we have two of our other working group members here with us. If you all would like to say hello and where you are from, that would be fantastic. Press the button on the there.
Got it. Hey, I'm Laura Baker. I'm with Nashville Humane Association. This thing's nice.
Brandon Dice with Pet Community Center.
Fantastic. Thank you so very much. So really, the purpose of tonight is to really let Director Harrington speak to the audit, how it went, what the experience was like, things that she learned that she might not have known, things that she shared with them that they might not have been aware of, just so we can keep everyone informed and aware of the work that we're doing. And I think that's the commitment that we made to you starting last term, and we are continuing that work this term. We are committed to improving MAC services, making sure their funding gets better, and making sure that their programs can increase the way that Director Harrington would like to see them increase. And with us now, we have Councilmember Russ Bradford, District 13. It's also part of the Pet Policy Working Group. So with that, I'm really just going to turn it over to you, and if you'd like to share with us, how did the audit come about? Did you reach out to them? Did they reach out to you in order to do that?
Yeah, so I actually reached out to them. They had come in, I think it was before I started with MAC and at the beginning. But I just wanted to see, compared to that audit and the document that they released then, how we were in comparison to that time. So no, I had reached out and we received a grant through them, so it was no cost to MAC or their budget or to the city. And they came in, they gave a lot of good advice. We were also already meeting the mark on a lot of things. As you read through the audit or consult, I think they actually call it, but a lot of things we're still doing based off their last recommendations when they came in. They did make some recommendations for going forward. Some of those things in meeting with the MAC leadership were a little nervous to do. Like they wanted us to, turn away all community cats, and I don't necessarily think that's the answer. They need to go through vetting, spay neuter, and they weren't saying don't spay neuter. They were just saying, turn away initially and then filter through Pet Community Center. But with your capacity coupled with our capacity, that's not necessarily doable. So it was nice to kind of be affirmed that we are doing a lot of things in accordance with best practices. But, there are obviously, some shortcomings in areas that we need to, revamp. A lot of it would be training. So we're redoing our ACO, how we train them, how we have been in the past. We're going through and trying to formulate what would be best if it's to offer our NACA trainings that they get certified for after their probationary period, if it's better to do that on the front end. And so those are some conversations we're in with my supervisors and leadership over at Lens as well. So.
Thank you. I have a question in regards to that. So this training that the ACOs do, what is it exactly? And so you're deciding whether they would do it like at the start of training or at the end. Is that correct?
Yeah, so when they initially start, what they're doing now is they're paired with senior officers, and they'll do basically on-the-job training from day one. So they ride with a senior officer. They're shown how to run our calls. They go over our policies. They're shown where all of our documents live on our shared drive. And it's basically a lot of just hands-on training in that sense. And there's a training manual as well. But they're also required within the first 2 years of their employment to complete 2 trainings to certify them as an animal control officer. And that's through NACA. There's 2 trainings to it. So ACO 1 training, ACO 2 training. But with that is a lot of useful and beneficial information that we're contemplating putting on the beginning side of it, not just within that first 2 years. But the hang up has been in the past that it's a cost, obviously. And then with turnover, is that the best area to put part of our budget if they're not going to hang out for, a long term of employment? If they're leaving after 6 months, we've just wasted that training allocation for somebody that's not there.
So I have a question about that. When you're interviewing, trying to hire new ACOs, do they have the opportunity to shadow before they're hired and through the ACO process? Do they have any criteria for or any requirement for prior involvement in any area within the shelter or any engagement that might mirror what they'd be doing as an ACO?
So we have 4 different levels of our ACO. It's ACO 1, 2, 3, and then the supervisor. So
Right.
in their job descriptions and requirements for those positions, there's different requirements for each. For our entry-level ACO, they have to have, I believe, a year experience in some capacity, whether shelter, ACO experience. We do get applicants that already have the NACA certifications, and those follow the applicant, so they already have those behind their, under their belt, so that's very beneficial to us. But for the entry-level positions, and that's the one we have the most turnover in, a lot of them don't have that, so.
I think it might be interesting to take a look at, when we start looking at the other things, is to take a look at the history within whatever reasonable time frame we can find it of ACOs that were in that position that didn't stay, and what, if we can find any trends of things that they may have or may not have had in similarity.
Sure.
And that might be something to look for or not to look for moving forward when we're hiring those folks.
Thank you. Quick question for anyone that doesn't know. What is NACA? What does it stand for?
National Animal Control Association. It's just it's like the ASPCA, but it's more geared towards animal control itself and that function, not just sheltering or vet specific.
You mentioned there was an audit done prior to this one. What year was that done? Do you know?
I want to say early 2016. I don't recall offhand. It was either 2016 or 2018.
Okay. And can you tell us the results that we just got versus the audit that you read from 2016? Offhand, where the areas that we've had that were improved? And I guess, do we still have some of the same weaknesses from 2016 to today?
I mean, without having that document in front of me, no, I don't, I mean, I can't speak to specifics. I know staffing and turnover have always been a point of struggle with us. We are nearly staffed, though, which is quite a feat. We still have some key vacancies, but our entry-level staff ratio has greatly jumped. From 2016, that was right when I first started with MAC, too, so how they were doing things on like a higher level, it wasn't something that I really had a hand in, so.
Okay. And I'd like to introduce Councilmember Aaron Evans, District 12, and Councilmember Jacob Coopin, District 19. Thank you for joining us. Does Councilmember Bradford or Brandon, Natalie have any questions in regards to what we've heard thus far? Yes, Councilmember Bradford.
So in regards to the ACOs and the certifications, being that it's required within the first 2 years, is there still a financial incentive? I know when I used to work in animal research, we had national certifications, and there was a total of 3 of them. The first one, we got a 50-cent an hour raise. The second one, it was a $1 raise. And if we got the third one, it was $2 an hour. Is there something similar?
There is not.
All right. That may be something for us to look at when we're looking at financials, because that might give folks an incentive, like, look, if they're going to pay for me to take this, but then they're also going to give me, some extra money per hour, that could incentivize folks to kind of hang around. So just food for thought.
To piggyback off of what Councilmember Bradford just asked, is that a conversation that has been had in the past at all about incentives?
No,
So this would be the first time?
yeah, it would be the first time that would be brought up.
Okay. Well, I'm going to jump in to the questions that we came up with. And if there are any additional questions, please just raise your hand and let me know. The first question that we had was, how are we doing with the safety net program? Can you speak a little bit to what that is for anyone that's watching for the first time and learning?
Sure, our safety net program it's also commonly referred to as a diversion program, and it's
Diversion? Okay.
diversion, and it's basically taking the steps to keep owned animals in their home with their family. It's one of our stronger programs. It's heavily supported by our Friends of Matt group. The program coordinator that we have over that takes a lot of pride. She started as a clerical staff member and was promoted into that position and kind of has taken it and ran with it and has improved the service from that. It's also heavily noted in the consult that it's one of our strongest programs. She does happen to be on medical leave, so we have clerical covering that right now, a combination of myself, another supervisor, and our clerical team. While she's recuperating, just so she doesn't walk back into a mess. And those that still need, services and resources are receiving those throughout. But it's going well. Again, it's one of our stronger programs, so we're quite proud of it.
Thank you. What did she do to make the improvements that have made it such a strong program from what it was?
The basis of it, the framework was there. I think we've been running that program for about 6-7 years, and it's based off of the Pets for Life program. She just kind of honed in. We sent her to a couple conferences now to network and has taken and expanded some of our programming. She wants to really expand our pet pantry, and when we can, wants to do a delivery system, kind of like mirrored after pet community centers. She has, hi Melody. She has just, made it her own. She's become more responsive than coordinators have been maybe in the past, making sure she's getting to all those phone calls, making sure community members that are reaching out for assistance are heard, and keeping in mind that it's just one person coordinating this program. She tries to be as attentive as possible.
And you just made me think of something, and then it just scurried out of my mind. That is unfortunate. Councilmember Coopin, did you have your hand up? Okay, I imagine that. Fantastic. Is this a position that you would like to remain as one person? Needs to be expanded?
No, it needs to be expanded. The safety net program, it encompasses, assistance with vet care, assistance with housing deposits for pets if a family has those, food resources. It could be training resources. We offer that through that program. She wants to expand into potentially, again, this is big picture, but wants to incorporate domestic violence support. So having a safe space for an animal to go to kind of take that worry off of, somebody who may be a victim of domestic violence. But those are all things that need staffing to help her. One person can't coordinate all that. Heavily noted in the consult was when ACOs go out into the field and their potential owner surrenders in the field, or even just stray found dogs and walking through a finder foster process. The ACOs are kind of just go, 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 trying to get to all their emergencies and don't have, an hour to spend explaining a foster process. They wanted to bump that back to the safety net program, but it's one person. So, bolstering that staff, or turning it into a staff team, not just bolstering it, but it is one of those things on, big picture scale that we would like to look into.
And I love to look into the future. So if having a safety net program, if you had your druthers, how many people would be on that team?
I think it depends on how big we can make that program. I think, working up to, if we're able to, have a new facility, we would like to see, upwards of 5 staff to support that program.
Let me
Councilmember Weiner.
Yeah, thanks. Let me just pause for a second. Councilmember Bradford has a question. You did? Okay. So the other thing I want to pivot to real quick that I think will kind of put things in perspective is I've been working with Ashley, and we have asked the entire team over there to create essentially roadmaps, and the roadmaps are going to be programmatic. In other words, if we get you a new facility, what's it going to look like and what programming is it going to offer? Because if we can make the case for the expansion opportunities and the growth opportunities and the increased number of services that we want to provide, that's going to speak volumes when we start looking at budgeting from a council perspective and when we take this to health department. Also have had some really good conversations with the folks at the health department about the expansion and the needs. So I think when Ashley's talking and answering some of these questions, these are things that we're currently getting put on paper, and I'll be sitting down with them in November, looks like, and we'll be reviewing all of those and taking a bit deeper dive into what that looks like, and we'll be able to come back and have really a roadmap that's a strategic plan in a broad scope that I think will really help.
And thank you for that, because we talked about it at the last meeting that you were going to be taking point, because
We were
this is your wheelhouse. You love
It's my thing.
operations, which is good. Everyone has passions. It's going to come in handy. So, and that is coming down the pike. I do want to be able to put some light things down so that it helps people.
Yeah, but just know that it's
Yes.
deeper dive
Comprehensive, massive planning coming. And yay, because it's well overdue. The domestic violence possibility. So I know that the YWCA Weaver Center has a pet program
Yeah, I
where you
think
can
they have
bring animals.
like 3 or 4 kennels there, yeah.
So would the goal be with a new facility and more space that
There would be
that
a
we have an
dedicated,
option
yeah.
just like that?
I would
Okay.
like a dedicated space away from our shelter population, that there would be a quiet space for those animals to kind of hang out until they have a new place to go.
Excellent. Thank you. The next question we had was in regards to field services. Do we have a permanent paralegal to assist with environmental court cases?
We do. Her name is Christine, and I do know her last name, but I will absolutely butcher it. I can text it to you.
Okay.
But we do. We've had Christine for quite some time now.
And has it been working out well?
Yeah.
Okay. I know I've been to court and I have seen some of the ACOs there, but I haven't seen Christine before.
She's usually up there on the table with the Metro Legal team.
Okie dokie. We'll have to look further next time I go on my next dog visit. Councilmember Bradford.
Yes, I do have one quick question to kind of go back to the conversation on domestic violence. With some of the fostering that MAC helps with, has that been something that you've looked at as well? You know, we may not have shelter space right now, but is there any way to maybe reach out to the foster network and say, hey, we have some individuals, domestic violence situation, can you foster these animals while they're transitioning?
We have in the past, and sometimes it has been something we can accommodate, but with our shelter population, we often are looking at our foster roster to kind of give the dogs that are like exhibiting high stress in kennel to get them into a home setting. So it's hard to manage that. Yes, we can if there's a foster available in certain situations and if the timing's right.
Any other questions?
I've got
I don't
one I
know.
just thought of. Is there a foster registry?
Like that you can sign up for? Yeah. We have a QR code and everything.
Is there one statewide?
Not that I know of, no.
Where is said registry?
Did you hear that?
We have it internally.
Internally,
It's
okay.
in our shelter management software. So we know who our fosters are, but statewide, no, I don't.
Excellent. Another question was, is there a partnership possibility with MAC and MMPD, I guess it would be ongoing. Was that your question?
I think for that one,
believe-
I need some clarification on, because I don't know what you're intending to ask.
It was in regards to extreme cases and if MMPD could potentially go into situations in case, I guess it was dangerous, the owners were dangerous.
I can't remember if that was my question or not, but I have seen, examples in the field where it's been a crime situation, MNPD has called MAC to come pick up an animal that in the area, but I can't recall if that was my question or what I was asking if it was.
I mean, I can comment on it
Councilmember Weiner,
broadly if
yes.
you
Yeah,
want.
well, there are two situations I think that may be coming to mind here, because I think this was turned in, and I think I know why, but it wasn't me. So two situations. One was the Bellevue West with Barrett and Bennett, and what it took to get the police to come out to support the ACOs when they went in to rescue the dog. So I think that's one issue that was brought up. And then the other one would be, I think, what just happened in Bellevue over on Cross Timbers when they had a major drug bust, and there was a little pitty that was left on the front porch. And if you'll remember, we had calls back and forth
Right.
about the dog. So I think let's address it both ways.
Sure. So for instances of arrest or what's that, a drug bust, for instances in that sense, MNPD is supposed to call us if there are animals on scene that need to be removed. They can't just leave them there unattended. Now, I don't know if this was a circumstance where the dog got out when they entered. I don't know with that situation. We were not called when they completed their
For
call.
Cross Timber.
Correct.
Okay.
And that could be simply somebody's arrested after they were pulled over for speeding. We get called very often if there's an animal in the car. So yes, they do know to call. I just think that sometimes they're not aware that there's an animal there possibly, or they didn't call, which, I mean, that has happened a few times too. But
And I guess my question in response to that is, who is the point person in MMPD that is supposed to be making sure that you are notified?
it would be the
It's just
officers
the
on
dispatch,
scene.
or it's,
Yeah.
okay, it's the officers
They need to
themselves.
notify, I don't know their policies on that, so
Okay.
that would be
Well,
a question for them. But
That's exactly what's,
Right.
I'm going to be doing.
I imagine they have to, filter it up through their chain of command, but they all should know that if there are animals, I imagine that's in their policies, if there are animals that need to be removed from an arrest or whatever it is, that they need to call us.
Okay. Any other questions in regards to MMPD?
So
And
we,
MAC?
we do
Okay.
have a partnership with them in the sense that when our officers issue citations, it's through environmental court, and it goes through that process. If it's a more extreme case of animal neglect or cruelty or what have you, it would reach a state level citation. So the MMPD is called out to issue that citation because we cannot. Sometimes they will be called first if somebody calls 911 or the non-emergency number, and they'll cite on their own accord, and we're not even called. That happens often, and that's okay. They're allowed to do that. They're allowed to prosecute. They've gathered the evidence. They're the police. They're very tuned in, how to prosecute this and send it through the court system. If you're speaking to, if our officers if it's a house that we know has been pretty volatile in the past, yes, we do call for police assistance, and they work it in with their call volume, which is usually quite high, as you know. So it does tie up a good bit of time, but also for the safety of our officers. There are several houses that we have flagged that they cannot go without police assistance, so.
So what happens if it's a new problematic house?
Mm-hmm.
You're calling to get assistance, you're being placed in the same queue as everyone else to be
Mm-hmm.
squeezed in to come. I think helping Metro Departments should probably somehow get squeezed in there. Sorry, speaking out loud. That's a conversation, that'll be part of my conversation about who's responsible for calling you. Anyone else? Before I move to the next one? Yes, Councilmember Bradford.
I will agree with what you're having to say because, these situations, if MNPD is triaging calls based on risk, harm to life or injury, they should be including animals because, if it's a situation where we know an animal's in danger or potentially life-threatening or whatever, that should be raised to the same level as if it was a human, because it's a life. And so I think that's a good conversation to have with MMPD, to see what do they look at, how they are kind of filtered in through the queue, and if they get bumped up because of potential risks.
I will follow up on these and put them in the Council Connect chat, which, if any of you have not heard of it, we now have a new way of communicating with each other outside of meetings. It is online, and the public can see everything that we talk about. So I will be posting the notes from tonight's meeting. The meeting notes from our previous meeting are up there as well. And it just allows us to keep ourselves informed and everyone else, so that you're not wondering what happened, did balls get dropped? No, not the case. We are moving forward, and so answers to these questions will be then in there as well. All right, next one is it possible to, I don't know where my English just went, but is it possible to modify work hours so that staff is not getting burnt out from 12-hour shifts? And is it possible to have volunteers man the phones after hours to cut back on?
So I think when you all read the consult, it just showed our blanket shift of 8 a.m. to 9:30 p.m. It's not one officer working that. It's broken up into 2 shifts. So our day shift is 8 a.m. to 4:30 p.m. So it's just an 8-hour shift. And then second shift is 1 p.m. to 9:30 p.m. 4 days of the week, Sunday through Wednesday. Right now, we have an overnight officer. It's just one officer, though, and his shift he works 4/10s. It's 9:30 p.m. to 8 a.m.
You said Sunday through Wednesday is the
Yeah.
overnight, okay?
And then the days that he's not on shift, the officers rotate an on-call schedule. And they respond to emergencies only during those on-call hours.
Did you say he works till 8 a.m.?
8 a.m.
Okay.
So it's not 12-hour shifts. There are many days where they do have to do some overtime, but they're not scheduled for 12 hours plus overtime or on-call.
Okay. And how many people do we have on each shift?
Generally, day shift has 2 to 3. Evening shift has 2 to 3. Overnight has 1. We're a little heavier staffed on certain days, so sometimes there's 4 mixed in there. But
Okay, excellent. Also, can we create a pet policy page on the website?
I
A
need
tab
some-
or something?
Yeah, what?
So I guess we have Council Connect and we can send people there, but wondering if there's a way that we can perhaps also share information as we're working on the MAC page, so people could go and click on a tab and just see an assessment.
Just give them the link and let them put the link on the page. That way it doesn't take up
The
space.
Council Connect link?
I'm good, no matter how it happens.
I like a good link.
Rock on. Information is the key.
Chair, was that also the question around kind of like spay, neuter, and I found a cat and all that kind of informational stuff? Is that where that was going? Because I had a question about, I mean, I get, as someone who's got background in animal rescue, I get texts all the time that are, hey, I found a cat, what do I do? And I'm kind of reinventing the wheel, explaining it to them. So I think we talked about maybe somewhere on the MAC page having that information, you know, here's best practices.
Sure.
If you
Like
find
an-
a cat in July, it's the middle of kitten season, you're less likely to, you know,
Sure.
things like
Yeah,
that.
Yeah,
like an
we can-
FAQ.
Like an FAQ, right.
Yeah, we can look into adding it.
And I'll put it on here.
That way I can share that link, because I like a good link too.
Okay. That was comprehensive of what to do in any situation, correct? Like I found a cat, I found a dog, I found anything, a turtle. How do we go about doing? Okay.
I found a snake, I know what I'm doing.
Don't talk about that because it just makes my skin crawl and then I can't focus.
I found a bat the other day, so yeah.
I could focus with a bat. Unfortunately, I was in Tim's Ford on Sunday and we drove down a back road and there was a snake in the street and I almost lost my mind. And I was in the passenger seat.
Will this also help when, someone finds a bunch of cows running around the neighborhood?
Sure. Sure. Okay, fantastic. So we're going to have a link for FAQs on what to do if you find an animal. Thank you very much. Still think it's good to have this Council Connect information so people can go multiple places to find this and not say they didn't know anything. Okay, any other questions in regards to the MAC page and anything that we need to add? Yes, no? Okay. All right, next question is, can NDOT purchase microchip scanners instead of calling ACOs for deceased pets in the right of way?
They can purchase whatever they would like. It's been a topic of conversation with them in the past. I'm not sure what the holdup is, but I know it's been discussed.
What were you told in your conversation? Was it oh, that sounds like something we can do?
They just
or?
reached out and inquired about if they could purchase them and then asked who our vendor was for it. So we gave them that information. I don't know what.
Follow up. Got it.
I'll call Diane, I gotta call her anyway.
Okie dokie. Thank you very much, Councilmember Weiner. Next question. Have we considered convening with other major city shelters in the state to come up with best practices? This was a question from Councilmember Bradford.
So, yes, I mean, we talk with other, the larger cities in Tennessee to talk about best practices, but those practices are already in place, and they've been put in place by agencies like ASPCA, Best Friends, HSUS. So there's already guidelines on what best practices is for sheltering, veterinary care, and all of that's laid out. And most shelters, I know you can speak to this too, most shelters already, are following those. So to not reinvent the wheel, those are already there. So, Memphis, Knoxville, Chattanooga, they are all following these same practices, so.
Oh, yes, please.
I would say that's correct. And you're part of ACAT, Animal Care and Control Association of Tennessee. She's a member. And so all the best practices that we're aware of, MAC is following. And then also the state guidelines that you have, I think, printed out there, you are in line with all of those. So I think if the assessment, anything that came out of the assessment would be any best
based on
practices
that
that have to be tweaked upon. Yeah.
And if I could piggyback off of you, Councilmember Bradford, is the question, is every shelter kind of operating from the same playbook? Because I know when we talked about policy, looking at different cities, other cities are doing different things. So how are people kind of coming up with policy, taking what the foundational items are supposed to be?
Go ahead.
Dr. Pisano did a shelter playbook, so it's funny that you say playbook. It's a literal playbook for shelters to follow, and she's part of the Shelter Team USA.
Sherry has the playbook.
Yeah, so that is what everybody follows. That is the most recent version. That is the
Right.
Bible that we all review. And it's got, illustrations in there, everything's spelled out. It's
Even
really
down
good.
to how to put together a kennel, and it's, from rabbits to dogs to cats, and it's like, to Laura's point, it's, illustrations on how to set that up. So those best practices, and it's literally a playbook. It's there, and it's for, use, and if, agencies aren't using it, they really should. So it's very helpful.
Question, sorry.
I was just gonna say, it is a proverbial cookbook.
Yeah.
Is there a link? Is it's something that,
I don't think there's an online version of it. Is
so
there?
it's just hard copy?
Yeah, I think it's just a hard
Yeah.
Just a hard copy, but I think it's minimal, $9.
Yeah, it's not expensive.
That is online.
Maybe on Amazon.
Potentially, yeah.
I'm just thinking it's something that
Oh, the
we
Tennessee state
can
laws are, yeah.
put on a page that people could see.
Yeah, I don't think that there's a web version of the playbook.
So it's just purchase it and then
Yeah,
you
yeah.
have your own personal copy of it. Okay. Okay. This refers to Pet Community Center. Have we considered stopping testing for animals when they come to the shelter? And Brandon gave me the exact testing. So I'm going to let you.
Okay.
Well, that's FIV and ELD.
Yeah, yeah.
That's for feline leukemia virus, and FELV is feline. Let's see, virus, yeah. It's best practice not to test for cats that are going back outside. So, and I know Councilman Coupin brought that up now. For cats that are going into the adoption program, I don't know that it would be, most pet owners may want to know if their pets have, or the cat they're about to adopt has one of these two viruses.
So just to clarify, just because it is on Council Connect with this.
And I'll fix it.
Yeah.
Yep.
It's stated as rabies testing. We're not testing for rabies. There's a very different way to test for rabies that does not include while the
I
animal's
will
living.
copy and paste his email. I
Yes.
will fix it,
No, it's
put it in
fine.
there.
So we still test for that, and I know it could save a good bit of money. However, when we did stop it for a while, when Lauren was still the director and when Dr. Cannon was with us, and there was so much pushback from rescue partners and adopters just because you want to make an informed decision if you're pulling an animal into your program or adopting it. So, yes, that's a good bit of money, but I also think that that transparency to an adopter or rescue partner kind of outweighs that money. That's our standpoint on it.
Gotcha.
Yeah, I would echo that. I know there's a number of rescues I work with that won't take a cat that's not tested.
Right.
I know sometimes we get false negatives and things like that. So to your point, if they're going back outside, does it really matter? We don't know.
Right.
But if someone's going to take it in, wanting to know what they're getting.
Excellent. Asking for the salary study. So we had a conversation about that. We feel like all of MAC, we should all know how everyone is
Yeah.
doing, not just two positions.
Yeah, I think it's being worked on. I know you reached out to HR last week. So they're working on it. I don't, and I think these next three questions are for,
Yes,
folks at
we
once.
asked. I was actually going to
Okay.
provide the answers.
Okay. I don't know where the salary study is in the process. There was talk of doing one. It paused. There's more talk of doing one. I know I've talked to all of you about doing one and the specifics of that, sorry. I know you and I have chatted about it can't just be like-sized cities and areas of service that are comparable. Now, we have to include growth for that because Nashville keeps growing. It's not going to stop growing, so we need to plan for that as well, so.
Fantastic. Well, now that all of us have asked, hopefully we should have, hopefully we will get some responses. We'll keep you informed. I did inquire about the new health director. That is not subject to the 2-week hold that we have on the other appointment, so they're going to be selected and we just pretty much vote on their appointment.
To touch on that, if I may.
Yes.
Chair Franklin has reached out and spoken about the process for that, and MAC will be not the focal point, but it will be included in the interview process. It will be included when the person comes out for site visits during the interview process. So we have a very supportive Board of Health at the moment. We have a very supportive council, especially you all in the room. But we also, in Dr. Wright, did have a supportive Director of Health, and the hope would be to continue that. That may not have been the sense in the past. We can't do anything about that, but moving forward, the hope is to have somebody step into the Director of Health that is supportive of an animal control function.
I'm really happy to hear that. I was hoping that in the description for the position, it was highlighted that animal care and
Yeah,
control is
it's-
part of your
yeah,
job.
Chair Franklin wanted to make sure that, MAC was a focal point within that interview process.
Good.
So
Excellent, excellent.
Councilperson Evans has a question.
Yes, Councilwoman Evans.
Thank you. I wanted to give an update, if I could.
Yes,
on,
please.
So I had a resolution, specific to the Director of Health that was on the agenda for the last meeting. And basically, I had elected to withdraw it. It will be back on the agenda Tuesday. What I'm doing is splitting it up. So there is the kind of pre-hire resolution, which is us communicating our support of the Board of Health process. There will be a post-hire resolution that if you go back and look at my original, it'll incorporate a lot of the things, that I had included related to a variety of concerns that the health department tackles, but also had reference to MAC in there. And the goal of that post-hire resolution will be for us to be able to use it to guide more accountability / conversations with the Board of Health and kind of what they look at as a board versus what we hear like in the streets, and marrying those two things. So just wanted to put that out there because there was reference to MAC in that resolution, and it's not gone, it's coming back, and there's, more to come on that.
Excellent, thank you so very much. The last question that we had was about putting a veterinarian on the Board of Health, and that was also around the same time that I was speaking with Director Hall. So the categories that they have to be eligible to be on the Board of Health, veterinarian is actually on there, it's just never been implemented.
Had anyone interested in being on the Board of Health that happened.
Thank you.
I don't think they have any candidates to be on the Board of Health that happen to be a veterinarian. It's something that they've discussed at just rumblings through the meetings. But it would be great. I think everybody would be supportive of it.
Councilmember Stiles.
Yes, Councilmember Bradford.
So on that, when I had conversations with Hannah and Margaret Darby about this, and they pointed to the code where, yes, it is an option, but I think we do need to look at, and I think it would have to take a charter amendment because the Board of Health is outlined in the charter. But I would like us to have that conversation about amending the charter to make a requirement that one of the people have a background, maybe not say a DVM, but a background, so that could be a vet tech, a veterinarian, just someone, because part of the job of Department of Health is rabies, and that's handled by MAC. So I really feel like instead of it being, you can pick someone who is a veterinarian out of this list, and veterinarian is one of them. I think we need to look at, all right, we need to make sure that there's always someone on that board with that background.
To speak up, yes.
So we are, I'll take this hat off and put a different hat on. As vice chair now of charter revision, Chair Cap and I have moved forward with an initiative from when I was chair of charter revision to include a repository for recommendations such as this one that we will keep on a list and a running list so that when it comes time to start adding things and vetting all of the different issues of things that can go on the charter revision hit list, if you will, we don't have to rush and think about things. We can culminate this list and put it together, so I'll make sure that that's on there.
Is that list going on a SharePoint? Because I had a similar
Yes, it will.
conversation with
Yes.
Hannah.
Yeah.
So we don't forget what our ideas are.
That's
Okay, so those were all the questions that came from our meeting. I wanted to ask about, I know I've heard about capacity and bringing animals in, so how are we handling our capacity issue?
So, in regard to, are you talking about specifically when we're closed for intakes? Mm-hmm. Okay, so we are asking the finders to, what we refer to as find or foster until we have space.
What does that mean?
They're bringing it home and fostering it. We're giving them resources for that. That could be anything from food, a pop-up kennel, whatever they'll need to house that dog temporarily. And then it usually will filter in within the next few days. They will call to follow up to see if we're taking intakes. Staff will they'll put in a found animal report, and that starts the stray hold. Everybody, they're not exactly thrilled about doing it, but they have been receptive to find or fostering temporarily.
Okay. Well, I had seen, I had seen a question regarding that about what do you do if you have an animal. So I had a question about this before, and you just brought it up again. The pet pantry,
Mm-hmm.
right? So you mentioned that ultimately in a new facility, that could be a program that gets expanded. Is the pet pantry, is it for people that are struggling in terms of financially to get items and they come?
Yeah, if somebody is, just hitting a hard spot in their budget for the week or the month, that they're able to come pick up, it's usually a large dog bag of food per dog, and that will get them by until they're, back on their feet or so.
And with the finder fosters, is the same situation, so they've taken an animal in, do they get to come to the pet pantry?
Well, we
and-
would offer that before they leave the facility because they're assisting us in temporarily fostering that animal. So we want to provide all of the resources that we can that they're going to need because they're taking on that burden. So they're given those items before they would leave the shelter.
And, you know, it's pretty much my job to ask all the dumb pet owner questions, so let me carry on my tradition, which is, okay, I've brought an animal, I'm finder fostering an animal. What are the things that you give to someone that has taken an animal in? What if I found a cat
Anything-
and I came and I was like, what do I do with this? I don't want to just leave it. Like that.
We will provide food. If they need a kennel for the animal, we'll give that. If they need bedding, food bowls, whatever they need to care for that animal temporarily, we'll provide that to them.
Oh, that's nice. Okay. Anyone else have any other questions? I mean, you're the king of finding animals, so you know what to do.
Something to joy.
Right, so I can panic and call Ashley. I think, do you have any other, I know you have your plan for, for operations, which is coming down the line. So for everyone watching out there, know that that's coming down the line. We will be posting when that meeting is happening. Co-Chair Weiner will be leading that. She is having conversations with Director Harrington about what the shelter needs are right now, how things are moving and grooving, and areas for improvement, SWAT, and all that good stuff. So, yes, Councilmember Bradford.
Just a question I want to put out there, you know, it's never too early to start thinking about the next budget cycle.
Correct.
And you'd mentioned kind of right now, knock on wood, that staffing levels are somewhat steady. Knowing that, all right, you've got the staff that you've been budgeted for, are there, like, what would you like for us to start thinking about for the next budget as far as additional staff, like more than what you need?
Sure. I mean, I'd have to take some time and put that together for you. That's not something I'm just going to be able to rattle off right now. But our capacity for care is still understaffed. So even if I had full staff shelter-wide, it's still not matching what the capacity for care could be or needs to be. It's, you know, each animal requires a certain number of care a day. With our ever-growing population, that's going to keep, you know, just increasing. So there's still going to need to be requests for additional staff. But those numbers off the top of my head right now, no, I don't have that.
No. You're good? Okay. So I know departmentally, the budget requests start really first quarter to pull that information together. Whenever you have that, can you let us know?
Sure.
Because the sooner we can start planning, as we ultimately get our budget wish list, as you know.
Sure.
But
Well, and I think too, as we have our conversations in November, okay, fine.
thank you.
I think too, as we have our conversations in November with the staff, I think some of that's going to come out organically. So there's that.
Councilmember Evans.
You kind of sound like you're starting to wrap up, are you? Okay, I might have missed this. I don't know if y'all talked at the beginning about pet community and, you know, from the last time when we talked, you were planning dates and kind of where you landed.
I forgot. That was in my head, but it fell out. Thank you.
Yes, so we did our first Friday fix, is what we're calling them, on the 27th. So we completed 28 surgeries, 16 dogs, and 12 cats. We had 32 scheduled, but that was the day of the downpour, so we had a few no-shows. Then we have another one scheduled for October the 25th, so we'll book 32 surgeries again, and then looking at also November the 15th. So that adds additional capacity. And I would like to add that we did focus on clients or community members on our SNAP list, which is the Spay Neuter Assistance Program. So of those 28 surgeries, 26 of them were fully funded by Friends of MAC. So in partnership to
Thank
make
you.
that.
Oh,
Yes.
come on. That's fantastic.
So
If people wanted to give money, how do they do that? I think that was, I mean,
petcommunitycenter.org/donate.
Okay, so I do have a question on this topic. One of
Yeah.
the things that you had said, and SNAP absolutely answered part of my question. You had said that you were going to look at areas of the community that may have the greatest need. You were going to identify so that you could get the word out to those specific areas. Have
Right.
you identified where those areas are yet?
I mean, we have that. I don't have them handy off the top of my head, but I mean, we do get, again, max intake data every month, and then we look at which zip codes have the highest rate of intake. For this one, we focused on the SNAP list. Again, we knew those were the clients that needed it most and had already raised their hand. We would love to have our animal altered. We just don't have the means by which to do it, so we thought we would focus there.
Councilmember Bradford.
A question that just came up, and this is for both Pet Community Center and MAC. When it comes to resources for pet owners, information for pet owners, are y'all able to provide that in languages other than English?
Yeah, we have most of our literature in Spanish and Arabic, just because those are the highest requests that we get. If someone comes into the shelter needing something translated, or a language other than that, we have a language line that we partner with that is able to communicate with them.
Is there a,
We
Counsel-
also have educational information
Yeah.
when we go out to the public. We have it in Arabic and Spanish also, in addition to English.
Councilmember Evans, I might be recollecting this incorrectly. Was it CityBot that could translate documents into other languages? And that's
Yes.
what okay, great. Well, as we're getting ready to go to NLC, we need to follow up on that. There's actually a chat option that cities can use that can translate into so many different languages, not just Spanish and Arabic, but they can put the question in and it'll change the language on the page. So to be able to have that on a Mac site would be fantastic. So I think that's another conversation for us as we talk about budget.
I wanted to, I guess, come back to my questions kind of about the dates. So it looks like from the original notes, you were doing these first three prior to the holidays, and then based on the 300 spay and neuter surgeries you'd be able to provide, so that would carry us into kind of right at the budget timeline. So
Correct.
did you, and I know, we had the discussion about like the capacity and your staff's capacity and that kind of thing. And so are you feeling like there's the potential to add capacity if we got more money? Or are you feeling like this is max? Oh, Ashley's got her hand raised.
I do. So being mindful of PCC and their capacity, Laura and I have, we're starting to partner on another initiative, and it will be spay neuter as well. Someone in their estate left us a pretty sizable amount of money as a donation.
Stop it.
So we're using that, and NHA is going to match that amount. And then after the turn of the year, we're going to look to start, Laura will deploy the Rover Mobile out into the community in areas of need. So that
That's
will
awesome.
look to add some more capacity there for that.
It's a mobile spay and neuter unit, so accessibility is very important, and some folks can't make it to us, so this would go out into the community. We currently have it, but staffing it, finding a vet, and not vampiring from our current staff. Brendan had brought up that, the welfare of our staff is very paramount. And so finding this contract vet is our biggest need, and it's not an easy feat, and it's very expensive. So if this is something we want to align, then we are willing to go out and try to find that vet just for this program.
What is the cost of the vet?
A lot. I mean, they can get $1,500 a day.
Oh, okay. Oh, that's not as bad as I was expecting.
Would you say that's accurate?
Yeah.
Yeah.
That's accurate.
Where like last year was $500 a day, probably, I would say. It's tripled.
Okay, I'm going to carry on with my questions. So we have a Rover Mobile that goes out to different areas. You just say, hey, this is my address, wherever it is, and then the Rover Mobile will come.
No.
That's not how that,
No.
see? And that's why I ask the questions that I ask.
No, so there will be a location, depending on what area they're going into on a certain date. And it'll probably rotate. The logistics of that, we're still working out. But it will be parked stationary at a location that agrees to have us on their property. And then people will have to transport their pet to that area. We can't go house by house. That's too much.
Can you explain how we feed clients into that program, how we talked about that?
There will be a QR code that we'll develop, and they would scan and sign up. ACOs will help get that information out while they're out on their service calls. It will be available in our lobby. I imagine you'll have it out for accessibility in your lobby as well.
QR code in the lobby and where else? On the web, would also be on the web
Yeah, it will be on the
page?
web
Okay.
pages too, but then the ACOs, while they're out running their calls for service, when
I
they
would
notice.
I would also ask that you send that to us as well.
Exactly.
Because a lot of us have
Newsletters.
newsletters, social media, anything we do to help push that out in our neighborhoods.
Okay, I want to go back to the part where you surprised us with there's been a donation.
I mean, it wasn't for a good reason. I mean, but somebody did allocate some money in their will, and what she donated was $35,000. So that will be, earmarked for that when we're able to get that up and running. And again, it would depend on staffing and not vampiring from either of our programs, and making sure that we're able to run this successfully. So.
And so for the 35,000 and then partnering with you, so you're providing the vehicle, we're paying for staff? Is that what was kind of what
I
that
think
would
that
look at?
money that we're pulling together is going to absorb all of the expenses that it would go into staffing, gas,
Okay.
Yeah, we broke it down per animal conservatively, and I forget what that number was, like dollar per animal. But we were wanting to pilot it for 3 months in the beginning of 2025, depending on staffing. And just seeing how many animals we can spay and neuter, and then I guess, looking how it's going and reassessing it from there and seeing how far we can make the dollar stretch. Because we haven't done this. I've been in this position for 7 years, and we've never had a partnership like this. So just making sure that we're communicating and addressing needs as they come about.
That's fantastic. As, talking about the first 3 months, because then we're really starting to have budget conversations, and as soon as I ask my question, I will come back to you. This sounds like something, if it goes well, that we can get behind and say, what is the budgetary
Yep.
requests that we can support? So please keep that in mind as you're moving forward.
Yeah, because I think last meeting, we talked about, I think it was like February 1st, departments had to have I think their first round of
Yes.
information in, to finance to start vetting it, if I'm remembering correctly. And so it's one of those things if, even though your pilot may not be complete, if the estimates could be included in whatever bubbles up on your wish list through that department, up to the board and everything, that would be super helpful. So that way it just starts the conversation. And if the pilot is, successful, or there's opportunity for improvement, whatever it looks like, then it just kind of adds that additional layer of time of more communication about it. So thank you for sharing that information, though.
Sure, and I just want to clarify, this isn't replacing Pet Community Center
This
and
is an
their
addition.
ability. It's an addition.
Yes, yeah.
And so the hope.
That's why we were excited.
The hope, right, the hope going forward is we would still maintain both of those partnerships, and if we're able to find additional partnerships with other clinics, we would expand this, as we can.
How many surgeries can the Rover Mobile do a day?
I just love that you keep saying Rover Mobile, because it's just Rover, but
Oh, okay.
I love that it's Rover Mobile now. That's what we're going by. It depends. It is limited on space because it's a mobile clinic. Typically 20 to 30, depends on if it's cats, it depends on if it's dogs. We try not to do any dogs over 60 pounds because the surgery table is small. So it kind of depends on what the vet is comfortable doing, but that's usually the guideposts that we have.
I mean, we've been in this meeting for an hour, and I'm just stuck on the donation. That's really, really fantastic news, and I'm looking forward to seeing how this pilot goes, so we can support what your needs are. That's a really exciting thing to be able to share as well when we put the notes together and post this to Council Connect. I think we are making progress. I know people would like us to click our heels and be able to fix everything overnight, but I hope that people can see how many people are working together in this term and how many different ways we're working together, looking at operations within MAC, figuring out financially what are we doing with budgeting, to know we're committed to this task. We're not letting anything fall to the wayside. We appreciate your patience. Thank you for your passion, and hope that you will continue to send in questions and send us emails. It keeps us on our toes, and it keeps us accountable, and it's really why we're here. So I want to thank everyone from the working group, and we have Melody Keep here from Friends of Mac. Thank you. She's also part of the working group. Thank you to everyone that is in the working group, especially the returning council members for this term and new council